Hello, Dr. Leah here with another health tip for you. I recently watched a fun and informative documentary on Netflix called The Truth About Alcohol. I thought I'd give a summary of the information in this documentary here for those of you who don't have Netflix or don't have the time or desire to watch the whole show. Recently, the United Kingdom's Chief Medical Officer issued new guidelines for alcohol consumption based on more recent and larger research studies that have been conducted. There's more evidence establishing the link between alcohol and cancer. Alcohol is a carcinogen, it modulates hormone levels, and it damages cells. There's technically no safe amount of alcohol for these reasons. However, the guidelines apply to the majority of the population who, if staying within these guidelines, shouldn't have a significantly increased risk of alcohol-related health issues. The UK's recommended allowance of alcohol is 14 units a week. This weekly limit is for both men and women, and it's recommended to be spread out over 3 or more days. 14 units is equivalent to drinking no more than 6 pints of average strength beer, that's 4% alcohol by volume, or 7 medium-sized glasses of wine, 12% alcohol by volume, and 175 milliliters. For reference, 1 shot of whiskey is 1 unit. A large glass of wine is 3 units. The standard glass of wine is 2 units, and a pint of beer is 2 units. Okay, so now let's go over some facts about alcohol's effect on the body. Perhaps some well-known and others not so well-known. Alcohol has immediate or short-term effects on the body, including impaired impulse control, reduced ability to multitask, increased pain tolerance, and increased blood flow to the skin, which makes you feel warmer, but actually increases your heat loss, making the body colder overall. Another effect of alcohol is increasing your appetite, which may be due to the lowered impulse control and less decision-making ability or other factors. So why do some people get drunk more quickly than others? That comes down to blood alcohol concentration, which dictates how drunk you feel. Blood alcohol concentration is determined by how much water is in the body, and this is based on body size and body composition. There's more water in muscle than in fat, so larger, more muscular people will have a lower blood alcohol concentration after consuming 1 unit of alcohol compared to a smaller, less muscular person who consumes the same amount of alcohol. So, if you want to handle your alcohol better, go to the gym and get more muscular. There is a common belief also that lining the stomach or having a meal before drinking can help a person handle their alcohol better. This is actually true because food slows the alcohol entering the intestines, which is where it's absorbed into the bloodstream, and therefore the blood alcohol peaks at a lower level. It's also commonly believed that red wine is good for cardiovascular health. Well, it turns out that red wine does promote dilation of your blood vessels and therefore may lower blood pressure. Also, red wine is more rich in polyphenols compared to white wine. For example, Sagrantino contains the most polyphenols, followed by Cabernet Sauvignon and then Merlot. But don't forget, we can get polyphenols from lots of other foods without the alcohol content. The amount of polyphenols in a glass of red wine can also be achieved from eating a serving of berries, coffee, pomegranate, cranberries, walnuts, or dark chocolate. Also, 360 milliliters of black tea or 1.5 apples has as much polyphenols as a glass of wine. Yet another common belief about alcohol is that a nightcap can help you sleep. Well, yes and no. Drinking alcohol before bed does help you get to sleep faster and sleep deeper in the first half of the night, but then over the second half of the night, it causes lighter and more fragmented sleep. So not the greatest solution for insomnia. In addition, the disruptive effect of alcohol on sleep progresses with age, so the older you get, the more alcohol will ruin your sleep quality. Bummer. Okay, so what about remedies for a hangover? Hangovers are caused by delayed processing of the toxins in alcohol, a drop in morning glucose, and also dehydration, which occurs due to the diuretic effects of alcohol. About 1 in 5 people just don't seem to get hangovers, probably due to genetic factors. One hangover remedy that may actually be helpful, but not in 100% of people, is taking a capsule of borage seed oil prior to drinking. The oil from the borage seeds has anti-inflammatory properties, so may reduce headaches and other hangover symptoms in a similar but healthier way than taking a Tylenol or an ibuprofen after a night of drinking. Some drinks may give worse hangovers. In addition to alcohol content, some drinks have a higher quantity of other chemical byproducts of fermentation, such as methanol. These other chemicals are called congeners. They often give alcohol a distinctive taste and may also lead to more hangover symptoms since the total load of toxins the body has to eliminate is increased. Generally speaking, darker drinks have more congeners. Red wine, 53 milligrams per unit, brandy, 34 milligrams, stout has 30 milligrams, white wine, 28, whiskey, 26, and then gin and vodka don't have any. So there you have it. The truth about alcohol is, if you don't want to get a hangover, then don't drink. But if you are opting to indulge in alcoholic beverages, keep it under 14 units per week. Until next time, be well.